My name is Siegfried Wagner. I'm a medical retina fellow at Moorfields Eye Hospital and a senior research fellow at the UCL Institute of Ophthalmology. So my research interest is mainly in the field of oculomics, and oculomics is the study of how we can use AI and eye scans, in particular scans of the retina, to understand systemic health and disease. So by that I mean, how can we understand someone's risk of cardiovascular disease, someone's risk of dementia? Over the last few years, we've developed expertise in health data science here at Moorfields and UCL. In particular, how can we link imaging data from patients routinely attending Moorfields with national data on hospital admissions, which could give us codes on dementia, heart attack, and stroke. The idea being that here's an eye scan that was taken in 2012, and we know this individual developed a heart attack or a stroke 4 or 5 years later. So we can start to develop prediction tools for those life-threatening events. My work recently has focused on how we can use features from those eye scans to predict heart attack and stroke in individuals who are routinely attending hospitals. I think what we've seen is that features from an eye scan are as good as some of the traditional risk stratification calculators for predicting heart attack and stroke. The signature one is probably the Framingham risk score. That's probably the original. And retinal imaging has been shown to be non-inferior to the Framingham risk score. Yeah, so the traditional approach in the UK and in most of Europe and North America is that when you turn 40 or 45, you attend your general practitioner and you have some blood tests, you have your blood pressure checked, you get asked lots of questions about smoking and family history. And those calculators are actually quite good at predicting your 10-year risk of a heart attack or stroke. What's the problem? Well, if you look at last year in the UK, 12 to 14% of people attended that health check. It's called the NHS health check. But if you look at people who attend their optician, their community optometrist to update their glasses or to get their eyes checked, that same age group, we see the numbers increasing to around 80%. People going at least every 4 years to their optician. So even if you've got technologies that are not as accurate as the ones developed in the general practitioner's office, for example, you're casting a much wider net for public health strategies, and you're going to identify a much larger number of people who are at risk and may not know it.